we're going to kick off our Smarter Benefits little webinar. This part of our shtick and webinar today does not count for CLE credit, but it can make you healthier and happier and less stressed out about your life. So Tim, tell us what we're talking about today.
Great. Well, thanks, Michelle. Thanks for everyone hopping on the call. We're going to spend a little time, about 10 or 15 minutes, to talk about the health plans that are offered via the Academy. So a couple of things we want to point out is that these plans are for all members. So individuals, sole proprietors, 1099s, and even small groups and large groups if you want to offer one of these plans. So these are available for all group sizes. A couple of things I want to point out before I walk through the benefit structure is things to be aware of. These are national PPOs. So they're in and out of the area, in and out of the state. So if you're in New York, you're in Florida, you're in California, you have access to doctors in every state that's out there, which is a little bit different than some of the public market plans that are available. So I'm going to share my screen. I'm going to go back and show you again your broker exchanges site so you can look up all this great information. So this is a site, once again, we talked about on the last call. This has access to all the data you would need to make a good decision. So the first thing we would do is I want to point out a couple things. These plans are medically underwritten, so there is a health questionnaire that would need to be completed to get acceptance on the plan. It is a pass-fail underwrite, so if you get accepted on the plan, the rates stay the same, and we've had a really high success in getting members on the plan. This phone number here is going to be driving you right to our call center, so make sure when if you like a plan, you call the call center and they'll help you with the enrollments. So let's talk about the medical plans. First, there's 2 suites of plans. There's 3 options in Cigna and 3 options on Anthem Blue Cross and Blue Shield. Once again, these are for all members. Individuals, groups, it doesn't make a difference to us. You can enroll any month you want. As long as you enroll by the 18th of the month, your coverage starts the 1st of the next month. So if you want coverage in July, make your call today. We got a couple more days for July open enrollment. So we'll talk about the Cigna plans first. I'm going to point out some of the key details. If you want something a little bit more detailed or something about a personal issue, feel free to put it in the chat, or you can email me separately. I can talk about any personal questions you might have. Let's do New York. The rates that we're showing here, these are national composite rates. So it doesn't matter if you're 42 like myself, if you're 55, 60 years old, the rates are the same regardless of what your age is or your location is. So we have also all four tier rates. So if you wanted to see 2 adults, the rates are for 2 adults. A parent and a child, so this is 1 child. So if you have 1 child, the rates would be as shown here. If you go with more than 1 child, you have the family rate. And the family is 2 adults and children. So let me walk you through some of the basics of the plan features. When you go on the site, when you're thinking about what plans works, first make sure you look up your doctors. Your doctors are in network. The provider searches are here. So for Cigna, you click on the Cigna link. It'll take you to the Cigna site. Put in your zip code, search by name, search by location, search by doctor type. Keep your searches broad when you look up your doctors, because if you get too specific, sometimes you get you narrow someone out of the search. Your SPCs, the legal documents, are all posted here. You'll see that there's no referrals on any of these plans. If these are national PPOs, there's no tiering to the network. So if they're in Cigna, they're in Cigna. You don't have to worry about their tier 1 or tier 2, any of those kind of other insurance tricks. These deductibles will only apply to your major services. So if you're looking for how the plan's going to work, you can look through the plan designs here. It'll tell you how certain procedures are covered. All of your doctor's visits on these plans are covered without a deductible, except for the HSA plan, which I'll talk about that one in a little bit more detail. These plans, so if you go to a primary, you go to a specialist, you go to an urgent care, there's no deductible charge for that. On the PPO 5000 plan, which is this plan here, the lowest cost plan at $614 a single, the only difference is going to be that your prescription coverage is after the deductible. So if you use medications, your prescription be subject to that $5,000 deductible. That and the HSA plan are the only 2 plans where that applies. Everything else, prescription is covered without any type of deductible charge. The prescription benefits, no cost for generic medications. So if you take a generic, they're covered for free. A preferred brand, these are drugs that have no, there's not another option in its therapeutic class that's cheaper or more effective. So you pay 25% of our discounted price on those medications. And the third tier drugs, these are name brand drugs that tend to have a less costly alternative. So if you're trying to find a way to get the medication for free or at a lower cost, and you're on a non-preferred, there are options available for you. You'll see the office visit co-payments are outlined here. So anywhere from $20 to $60 depending on the plan that you take. Once again, with no deductible charge. All of your wellness coverage is covered at 100% with no deductible, so it's covered for free. And within all of our plans, there is a $5,000 of term life insurance included as an added benefit to being an Academy member. These plans, as you'll see, have in and out of network benefits. So if you go out of network, we reimburse the providers at 125% of Medicare. And if they charge you more than that, they can balance bills. So that's why it's really important to stay in network. But we do give you that protection of making sure if you need out of network benefits, we do give you the out of network benefits are available. On the Anthem plans, the top selling plan is our Blue Card 2500. It's a $2,500 deductible. Max amount of pocket is $8,150. That is the most money you would pay in a calendar year towards your health insurance benefits. So if you incurred $1 million in charges, you'd be capped at $8,150. If you have a family, it is two separate deductibles and two separate max amount of pockets. So in this example, one member in your family would incur $2,500 in charges. They're now in benefit. The rest of your family unit would add up to the other $2,500, and now they're all in benefit together. And the same for the max amount of pocket. $8,150 for an individual, you'd be covered at 100% for the rest of the year. And the family, once again, would add up to the other $8,150. The Blue Card 350 is our richest plan. It has a $350 deductible, which is lower than you'll see anywhere really in the New York market for individuals. Out of network has a $700 deductible. The out of network deductible is lower than most in-network deductibles you're going to see for the members or for the individuals in small groups we see. And it has a lower max amount of pocket of $6,750. So if you're worried about that top end exposure, you want the best of the best, this Blue Card 350 is a really strong offering to give you access to national providers with the best cost sharing available. Out and on this plan as well, outpatient mental health. So if you see a therapist, it's a $35 copayment. The other plans, it would be deductible and co-insurance. We had a question here. Let me just pull the question up real quick. Oh, I think Michelle took care of that one. The HSA plan is a very nice plan to look at if you're looking for a way to use insurance to help you either find ways to lower your taxable income or as an investment vehicle. HSAs allow you to pay for services and contribute through an HSA or a health savings account where you can contribute money into this account. There is tax benefit to it, as well as the ability to pay your out-of-pocket expenses with that HSA account. With this plan, all services would go through the deductible first, except for your preventive care. Once you've satisfied that deductible, everything is covered at 100%. So if you're thinking of a way that health insurance can help you with your taxes or help you lower your taxable income and you're relatively healthy, the HSA account is a really, really strong option for members considering, looking for something along those lines. Any questions on the plans? I didn't see anything in the chat. Chuck, anything you'd like to add?
Sorry, I'm muted. No, I just want to reiterate what Tim was talking about at the outset, that if you are a solo practitioner of Council 1099, that the tremendous benefit of these plans is the very large national network and large access that it provides throughout the country, primarily in our local area as well.
And just so you know too, if you're on one of these plans, you're on you're on a marketplace plan or an Obamacare plan, you can terminate them at any time. So if you know, I've had a lot of members I've talked to through the academy that are paying over $1,000 for an individual rate. That's way too much money to pay for, some of these plans. So we can offer you coverage. It would start the first of the month, and you can cancel your current coverage for any month at all. So don't think that you have to wait till January to make this decision, as we can start saving you money and giving you a better plan today. Well, and with that, just want to leave you with one more note. Just if you're interested in the plans, you want to find out some more details about the plans and how they can be best served for you, please contact our call center, the 877 number on the screen. You'll also see emails and text message correspondence from Meridio, who is our call center partner. Respond to those, schedule your time to talk to one of our live enrollers, and hopefully we can find a way to save you money and give you a more comprehensive health insurance plan. All right.
Awesome.
Short and sweet.
Short and sweet, Michelle, right?
Yeah. Anybody else have questions? Feel free to throw them into the Q&A. We've got Tim and Chuck here, so we should throw it at them. Oh, we got one.
There we go. What is the monthly premium on the Blue Card HSA? You have a strong policy, roughly $900. So the Blue Card HSA for an individual is $648, which will be one of the lowest cost plans you're going to see available in New York, especially for individuals or solo practitioners. The lowest cost plan that we're going to offer is that Cigna plan. That was about $636. So those are the two lowest cost plans we'll offer. And it doesn't matter your age or location.
Juicy stuff.
Exciting, Michelle.
This is what I'm saying. This is how you get. If you just want dental and optical,
No problem.
is that possible? Sure. If you
Absolutely.
only care about your eyes and your teeth, fine. Go ahead, Tim. Give him the actual answer.
Michelle's answer was the actual answer. So yeah, you could offer, if you like your health plan, you want to have access to dental or vision. Let me share my screen again.
You can keep your health plan.
You can keep your health plan, and we can offer whatever other benefits you're looking for. So dental, we have Solstice, we have MetLife. The Solstice dental plan has a $3,000 max at $67 a month, which is a really strong deal. The MetLife plans, we have offer plans that include orthodontia, that have coverage for implants, extractions, all major services. So these are very comprehensive plans that have multiple levels of price points and levels of benefit, and the same for the vision as well. And all these can be purchased a la carte. Thank you,
Anybody else
Michelle.
have questions? We can, we can ask about any of the products. It doesn't have to be just health. I mean, today we were supposed to be sort of talking about health, but you have our attention. So if you have a question, feel free to throw it out there. Again, if you, probably the best way for everyone to get information is to just call that number, the 877 number, and talk through exactly what your needs are. With one of the reps that really understands the in and outs of these plans. So like somebody had asked us before, just after the CLE, and how the plan stacks up against with those offered by New York City government attorneys. Like, I don't know, but if you go call that number, they can give you all the very specifics of, exactly what you can get. They can make you a really pretty chart that shows you comparisons side by side. They do all that lovely stuff.
And the question before about, what can we purchase? Everything we purchase a la carte. So if you have a health plan you like, we can show you things that you can do to help offset your deductible or out-of-pocket expenses through really low-cost plans that cover hospitalizations or accidents or cancer specific or any major condition. So just because you have health insurance doesn't mean you're fully protected. We have ways to keep your money in your pocket. So if you have a higher deductible, or if you have cost sharing, there's lots of ways that we can give you options that won't break the bank, but protect you in case you need to use those services.
Awesome. All right, and somebody asked my favorite question, which is how do I join the Academy? And so I'm going to type that answer in, but it's also right here next to my head. So you can always just email us, info@trialacademy.org, or call us. That number is 518-364-4044. You can also use either of those numbers to get to Chuck and Tim. So you can always just email us and we will pass pass it along and send you over to the right people, connect you. So you can always feel free to reach out to us too.
And also, this is exclusive for Academy members. So if you're not a member, we do cross-reference Michelle's list of people on the good list. So if you're not an Academy member, we're going to push you back to Michelle to make sure that you are a member for access to these plans, because they're very strong offerings. These are national large group style plans on all different levels. So this is exclusive to the Academy. So make sure that you join today if you're interested in these plans.
Yeah, and trust us, the joining part will be the least painful of your health insurance. Your health insurance signing up financial situation. We're very cheap comparatively. And we offer a tremendous value. Plus, we're good for your health, your emotional health mostly. All right. Are we good? Any other questions? Last call. Otherwise, we're doing this again for 2 more CLEs. I forget exactly what we're talking about for the next 2, but we're going to bring Tim and Chuck back after the next 2 programs as well to talk some more. So, poke around on our website, trialacademy.org/smarterbenefits, or call us or email us. We're pretty easy to get in touch with, and let us know if you have other questions. We'd love to hook you up. All right.
Thank you, Michelle.
Great.
Awesome.
Thank you, Michelle.
Thank
Thank
you,
you very much for your time. Appreciate it. Thank you.
Peace out, everybody. See you soon.
Be
Bye.
well.
Bye.